how do we make this world, in our part of the world, which is California, of course, a better place for these folks? How do we make sure that they are getting the best care possible?
That's today's guest on SideBar, Dr. Chad Harris, the Chief Executive Officer of Natividad Medical Center, located in Monterey County.
SideBar is brought to you by Monterey College of Law, San Luis Obispo College of Law, Kern County College of Law, and Empire College of Law, located in Santa Rosa.
Welcome to SideBar, featuring conversations about optimism in action with lawyers and leaders inspiring change. And now your co-hosts, Jackie Gardina and Mitch Winnick.
Jackie, I'm very excited to have our guest today, Dr. Chad Harris. Chad is the Chief Executive Officer of Natividad Medical Center here in Monterey County. But equally important, he's on the executive committee of the California Association of Public Hospitals and Health Systems, a mouthful, but an organization that has a very large mandate on what they're attempting to do. We're going to talk today with Chad about some of the public policy issues that are going on with healthcare, particularly in California. But as we know, those issues are happening countrywide.
Chad, I want to welcome you to SideBar and thank you for joining us today. I think probably having optimism in the public health sector is one of the most important things we could talk about right now. So thank you for joining us.
Thank you, Jackie and Mitch. I'm looking forward to the discussion.
Chad, tell us a little about the California Association of Public Hospitals and Health Systems. It represents 17 public healthcare systems across the state of California. And in looking at your website, it has a number of very important mandates. Give us the overview.
Thanks, Mitch, for the question. A good way to understand who we are, who CAPH is they ultimately represent all the county hospitals and the University of Californians in California. San Francisco, Santa Clara, Alameda, Contra Costa, San Joaquin, us, of course, down south, Kern County, Riverside, San Bernardino, LA, Ventura, and then, of course, the UCs. I think it's helpful to kind of understand the history. The public hospitals have been here in California before California was part of the United States. I'm proud to say first public hospital was Natividad. Back in 1844, prior to when we were a state, there was a public hospital outside of Monterey. I think people would anticipate it was one of our larger siblings out there, Los Angeles or San Francisco, but Natividad has been here since the very beginning. By 1914, almost every county in California had a public hospital. In 1933, essentially the counties were mandated to cover those most in need. And of course, the UCs are here continuing to carry the torch, particularly those that are underserved. I think it's also helpful to understand who do we in the broad context serve? We represent roughly 6% of all California hospitals, yet we see 3.7 million patients annually. That also includes 12 million outpatient visits per year. So we're talking very large scale. And when we talk safety net, it truly is a very large scope across the state.
What makes a public hospital different than in terms of mission and services than a private hospital?
I think that's also a really great question. I'll start with CAPH's mission, and then I'll segue into Natividad, because what you'll notice is they're incredibly similar. At the end of the day, it's really caring for all the people in California, particularly those that most need it and the vulnerable, those without a voice. The mission of CAPH is to strengthen California's public healthcare systems and advance high-quality, equitable care for all Californians, and then ultimately to advocate for health policy and financing at state and federal levels to ensure that the public healthcare systems that form the backbone of the health safety net and improve overall health of all of our communities.
Does that mean for your services that you can't deny service to anyone who enters the hospital?
Absolutely. We're here for everybody, and we really want to make a difference and make sure everybody is getting great care, regardless of who they are, where they come from, where they reside, how they're able to pay. And then as far as Natividad's mission itself is continually monitor and improve the health of the people, including the vulnerable in Monterey County through coordinated, affordable, high-quality healthcare.
One of the things you've mentioned a couple times, equity. Equity and health equity, I don't think that's a term that comes to our mind. Tell us what that means and what does Natividad and CAPH do to defend that?
Well, I think we're doing it every day, whether it's as an individual patient or whether it's on a broad-based perspective from if it's Monterey County or if it's the state overall, or even advocating on that federal level. Equitable care is making sure everybody is getting excellent care, equal care, regardless of who they are. Another key theme for CAPH and Natividad as well is really transformation. How do we make this world, in our part of the world, which is California, of course, a better place for these folks? How do we make sure that they are getting the best care possible? One program from a CAPH, it's called QIP. This is a program that's focused on Medi-Cal managed care patients, but is really all about improving equity and quality for these patients, from perinatal to pediatrics to cardiology, some inpatient metrics, depression, and really looking at that and how do we make it better? And one of the things that Natividad has done particularly well is really looking at that data, stratifying it, and honing in on where we can make differences for our population. For example, I'm happy to brag, Natividad just received an award called the Gage Award, which is through America's Essential Hospitals, which is I like to describe it as the US version of California Association of Public Hospitals, where we received the only equality award and recommended by a very large breadth of the public hospitals in the United States, several hundred. It's really quite an honor. And what we received it for was closing the gap on perinatal anemia, focusing in on Latina moms and specifically Mixteco, one of the indigenous languages here in Monterey County, closing that gap on anemia from mom to baby and those long-term outcomes from a morbidity perspective. I'm really proud of our entire team. Yes, it represents Natividad, but it also speaks to who we are as a California Association of Public Hospitals as well. And that's really what it's all about.
Congratulations on receiving the award. It speaks volumes, especially when it was at the U.S. level, the national level. We're facing, and it's in the news all the time, potential huge losses to healthcare funding. You serve populations that are underinsured or uninsured or at risk for losing what little insurance they have. I'm wondering how this is going to affect your ability to meet the mission.
Jackie, I appreciate that. One of the things that you said in the very beginning was optimism. I think it's really critically important, especially at times right now. Natividad's been here for 139 years, and since we were the first, I always say we're going to be here at least another 139 years. It's really critically important. We're here not just as a hospital, we're here as the public health, the community health. We're here for our communities. And we have to be. There is no other option as far as I'm concerned. We all come in here serving our missions every day across all these systems. But these are trying times. We really have to watch this very closely and see what the impact's going to be. More on the immediate horizon is we're talking approximately $8 billion of ACA, and it has been extended since 2014. If that is not extended on October 1st, that's going to have a profound impact across all of us, including the CAPH members. For the CAPH world, that's approximately $800 million. We are not talking small amounts. The other potential programs and to be on the lookout for probably hasn't gotten quite as much attention are the discounted pharmaceutical plans for those that work with the Medi-Cal population. There are a number of things that are out there that we are all looking at. Again, we've all been here for many years. We need to be here for those that are underserved. We've been at the front line, making certain that these folks get top quality care.
Chad, if I could just have one more follow-up question about the funding piece, and it goes more to what you received the award for, which is that you really focused on a particular population that was struggling in the perinatal context and struggling with anemia. And you targeted that population because of, I'm sure, research or information data that informed your outlook. Is there going to be funding available to target Latinas or Mixtecas or LGBTQ populations, or are you at risk for losing funding because you target those individuals?
We are at risk. We have a lot of fantastic programs. We have numerous interpreters that are here. We have other avenues too. It's really unique for us to have these indigenous speaking interpreters here to, of course, interpret, but also to advocate for these patients and also their families too. Programs like that, it's a real worry. We need to continue these for the community. For us, we're a level 2 trauma center, and the CAPH members represent a little over half of the trauma and burn centers in this state. These are really important services. I think we think of accidents and those sorts of things, but it's also a public health need and commitment that we all collectively as CAPH members and public hospitals and systems have for the state. We as a CAPH, the public health system, train nearly half of the doctors in California.
Jackie, I wanted to take a moment to reflect on our theme, optimism in action. Many of our guests began their pathway of a career in public service at a young age. Some were inspired by their parents, some began working for the greater good in college, and some, like our students at Monterey College of Law, became inspired to use their law degree to focus on public policy and support for the underrepresented members of our community. Our family of nonprofit accredited law schools that include Monterey College of Law, San Luis Obispo College of Law, Kern County College of Law, and Empire College of Law provides working adults with the opportunity to attend a part-time evening program at one of our campus locations or by attending our online hybrid degree program. If you're interested in learning more about one of our law school programs, go to www.montereylaw.edu. Chad, let me focus back on something you mentioned. You said that the state law says that if someone comes into the Natividad emergency room and needs care, you give care no matter whether they can pay or not, or regardless of whether there has been a funding cut at the national level. So is it fair for us to be concerned at a local level to say, wait a minute, they cut Medicare. There's no longer the money to pay for it at the state. It comes to the county. Not every county can pick up the difference. It ends up locally, probably in local taxes, supporting county activities. Isn't this really a conversation that impacts every single one of us, regardless of whether we think we'll be going into a public safety net hospital or not?
It does. And it is the Medicaid funding or the Medi-Cal funding for us rather than Medicare. At least that's the primary focus. It does. And I think as a reminder, the CAPH members, they reside in approximately where 80% of the California population is. So even if it's indirect, but directly 80% of the population resides where we are. We do need to be concerned and watch this very carefully. We have to sustain. But if collectively we as the public hospitals lose funding, we have to continue and we have to really look at how are we able to do that. Trying to maintain services, all these important services are absolutely critical. And I'm sure my other colleagues would agree in their role to support the public hospitals.
Chad, what are some of the most urgent next steps? We look at that here in our county. We've got a unique population. We've got a large agricultural community. We've got a disproportionate amount of both wealth and jobs, our ag, hospitality, higher ed. We don't have the breadth of industries such as a San Jose that'll have high tech and other emerging businesses. Is this a particular concern for counties like ours, and which span all of California and much of the Midwest? I don't think this is unique to California.
I would say definitely for rural, but also the urban centers too. The more urban counties, they're very large, like Riverside or San Bernardino, to be the size of New Jersey, right? Even Monterey County is the size of Connecticut. For those listening outside of California, I know I'm also work nationally on various things to give context of how big we really are when we're talking. Yes, I think it is a real worry for rural hospitals. I will say this, there is some potential funding in the order of 50 billion, but across the United States. So that's something to watch, but keep in mind 50 billion when we're talking the entire US of A, all of our rural areas, and thank you, Mitch, for pointing that out, in the Midwest. We'll see how much impact it would have. The other thing I would say is I also work with a group for graduate medical education nationally, ACGME, really focused in on the medically underserved. I served as their chair. Speaking to folks about the impact, I think is really important. In fact, next week, I'm speaking with them. How do we look at this from a rural perspective, from an ACGME perspective, not just family medicine, but surgery, OB? We've got hospitals and health systems in very rural areas, Indian Health Services. One of my counterparts in Idaho is also going to be speaking next week. Understanding that these are the future torchbearers of the rural and the public health in the United States. We need to make sure these folks are there to care for their communities well into the future.
Chad, that's just a perfect segue, I think, to talk about what we hear about in terms of the crisis of healthcare workers in the United States. It intersects with a couple of things. Immigration and the crackdown on immigration is going to affect that, because I know there's a lot of people who come to the United States to serve in the healthcare field. But I'm also wondering about people entering it, high burnout rate, really challenging work environment, challenging perhaps politically as well with the shifts in public policy and funding. You were in the education field as well as serving patients. So what do you see as next steps in that arena?
I'm always optimistic. And one of the things I always tell the residents, and it's part of the reason why I am where I am today, is I still love seeing patients. I actually still take care of folks in the clinic once a month. And I do stuff in between things as an administrator. And I still love every day being able to make a difference for one person, that person who's my patient in that moment in time, or whether it's on larger scale, like what we're talking about today, whether it's for Monterey County, or whether it's for the state of California as a public safety net, or whether it's for the US. And I tell the residents, the main thing is, and what you need to do is just make a difference. If you're making a difference for one person, that is fantastic. If you want to go on and make a difference for all the public health in the US or even further beyond, many of these learners go out way beyond the borders of the US. That's what's important. Just make a difference. It's not how you make the difference, it's just make the difference. I still believe in that optimism. I still believe in our learners. And I think it's critically important, and we need to encourage them and we need to support it. And it's why I think it's so core to our mission for physicians, of course, but also across the board, across all medical, allied health nurses, OB techs or surge techs or lab techs. All these people are fundamentally important to carry that optimism, and whether it's to make a difference for one person or more broad-based in their realm. The main message is make a difference.
Chad, let me go one step further. I happen to know, because I serve on the Natividad board and have seen many of these programs in action, I also know that volunteers play a huge role and somewhat invisibly in the healthcare system, both out in the community and in the medical institutions. If I'm someone who has no chance of ever being a medical professional, but I would like to do something, talk about the role that volunteers play in communities, particularly in the communities you're serving.
Specifically to Natividad, we definitely have a group of volunteers here. And I think that is one way people can make a difference. But I don't think it has to be at a hospital. At the end of the day, again, it's get out into your communities, make a difference, whether it's for your neighbor or whether it's your street or whether it's your town or your village. I worked with a group of local indigenous folks a few years ago through a program called GARE. One of the things I said is also don't forget you have a voice. You don't need my voice necessarily. You have a voice too. And I think it's really important to share that voice so the community understands. And that is a way to make a difference. Yes, I'm focused on healthcare, of course, but I think the main thing is get out there and make a difference. There are lots of different things from a healthcare perspective. The primary focuses for CAPH are all these social determinants of health that are not necessarily innately thought of as the health issue, but really so fundamentally they're at the core, whether it's housing instability or substance use or just the environment in which folks live in or the work environment.
You've already spoken a lot about optimism, but one of the things that really struck me about the mission statement for Natividad is the very last sentence that you have there, which is that you're going to build joy and sustainability in your work. How is it that you do that in the current healthcare environment, especially with equity as your North Star?
It's definitely challenging right now, but we just have to remember the mission. When anything is difficult, but particularly when things are difficult, I always start with the mission. It always has to be about the mission. And the other thing that's absolutely critical is sustainability. So yes, we need to celebrate all the fantastic things that we do, but we also have to be absolutely certain that we're sustainable, because we really do have to be here for our community, and whether they're the patients or the families working in the cities, or whether they have housing or not, whether they have challenges with substance use or working in the fields, we have to be there. When they aren't exercising their voice, we are their voice, and we want to make sure they have excellent care. So is it a challenging time? Absolutely. And do I think we're going to have more challenging times and potentially very difficult decisions? Yes. But that mission is always at the forefront, and we have to remain optimistic.
Chad, thank you very much for joining us on SideBar. What a perfect segue is to our purpose of SideBar, optimism in action, to talk about those who are doing things to build up the foundations of our community. And certainly healthcare is one of the primary foundations that define a community. Thank you for what you're doing at Natividad and with what the California Association of Public Hospitals is doing.
Thank you, Chad.
Thank you, Jackie and Mitch.
Jackie, what a pleasant opportunity to take what I thought was going to be a very challenging subject, which is addressing the healthcare needs, particularly for those who are in the greatest need, the underprivileged, the underserved, those who go to safety net hospitals for emergency care and their medical care. Honestly, before we started today, I was really in somewhat of a dark place, worried that we're going the wrong direction. And then Dr. Chad Harris comes on and says, be optimistic. We're working on these issues. We are dedicated to serving these communities and our communities, and we are not going to consider anything else other than performing that service. How positive can you be?
I have to agree with you there, because right now in the public health sphere, it feels so dark and dark ages like. But you forget that there are the nurses and nurse practitioners and doctors and everyone else in the healthcare field that got into it, especially those that work in public institutions, because they want to serve the people. And they get up and they do that day in and day out, regardless of what's happening at the federal level or what funding decisions are made or anything like that. And with that said, I need to give a shout out to my family members that are in the healthcare field, because I have a sister who's a nurse. I have a niece who's a nurse. I have a nephew who's a doctor, and I've got a nephew-in-law who's a doctor. And in fact, the nephew-in-law who's a doctor is working with the indigenous populations in Alaska and goes into the far reaches of Alaska to serve those who really don't have access to healthcare. And it's important to remember, it's not what's happening on Capitol Hill. It's not what's happening in Congress. It's those people who go in and are there to serve their communities every day. That's healthcare in the United States. What a wonderful message from Dr. Harris today. Once again, I want to thank everyone who joined us today on SideBar. And as always, Mitch and I would love to know what's on your mind. You can reach us at sidebarmedia.org.
SideBar would not be possible without our producer, David Eakin, who composes and plays all of the music you hear on SideBar. Thank you also to Dina Dowsett, who creates and coordinates SideBar's social media marketing.